In this video we will discuss about frozen embryo transfer or cryopreserved embryo transfer procedure. Cryopreserved embryo transfer is a procedure that follows various stimulation for egg retrieval, embryo development, and culture. The egg is first fertilized and the embryo is then frozen and preserved. The frozen embryo when needed is then thawed while we prepare the uterus for embryo implantation with hormonal supplementation using estrogen and progesterone. The embryo is transferred while the recipient is awake, as this is a painless procedure. A flexible catheter is inserted through the cervix into the uterus under ultrasound guidance. Due to the curve to reach the uterine cavity, sometimes there are chances of slight obstruction which is easily handled by the physician, and during this obstruction, ultrasound helps to guide the physician to reach the correct site. A gentle embryo transfer is very essential, as an embryo which is gently done without any bleeding has higher chances for pregnancy, and it's very essential for the physician to use ultrasound to guide him for implanting the embryo. Types of cryopreserved embryo transfer: fresh IVF embryo transfer and frozen embryo transfer. The follicles are stimulated to retrieve the egg for in vitro fertilization. If the fertilized embryo is implanted in the patient in the same cycle, then it is known as fresh embryo transfer. Alternatively, we can freeze the embryo and can plan for transfer in the future cycle. This procedure is known as frozen embryo transfer. Of course, in the future cycle, the patient will only undergo the embryo transfer process and not ovarian stimulation or egg retrieval. Indications for frozen egg transfer. Fresh embryo transfer was earlier believed to have better pregnancy results, but this myth was later broken by some studies. Frozen embryo transfer has a better pregnancy outcome when compared to fresh embryo transfer. How are the embryos frozen? The embryo is frozen through vitrification or extra rapid cooling of the embryo to prevent ice chunks. This process of cryopreservation has improved the survival rates of the embryo by up to 90% when compared to the older methods of freezing embryo. When the embryo is frozen, it is stored indefinitely in liquid nitrogen. When the recipient is ready for transfer, these embryos are thawed and will undergo frozen embryo transfer. Thanks for watching this video. Check the details provided in the description to learn more about this topic. Don't forget to like, share and subscribe our channel.